We are in and we have started recording. Dr. Viva,
Yes, sir.
we are all good to get started.
Thank you so much, sir. Good evening, all of you, and welcome all of you in the webinar organized by Vitality Healing and the Homeo Healers Homeopathy Worldwide. So, all of you, as we all know, the organizers, Vitality Healing, and the Homeo Healers are here with the great speaker with us, Dr. Kavita ma'am, as we all know about her very very well. So, before going to start our today's session, I'm just like to introduce our organizers one by one. So, I'm going to start with the Vitality Healing. So, Dr. Nidhi Sharma, she is the director of Vitality Healing. Vitality Healing worked on trinity of body, that is mind, body, and soul, by serving homeopathy, yoga, and nutrition together. Vitality Healing is a lifestyle clinic which will correct lifestyle. Dr. Nidhi awarded by Best Homeopathy Doctor in UP in the year of 2021. So this is about Dr. Nidhi and the Vitality Healing. Now I'd like to introduce the Homeo Healers Homeopathy Worldwide. As the director of the Homeo Healers is Dr. Rohit Bhandari, sir. Uh, the Homeo Healers, Homeopathy Worldwide, is the name which works with dedicated homeopaths and students, a team who knows his responsibility well towards the homeopathy as well society. Our mission is to make homeopaths who will lead the society. The Homeo Healers Homeopathy Worldwide is spreading the milestones of homeopathy by its untiring efforts with efficient teamwork to promote homeopathy worldwide. We are bound to serve best in the field to encourage students because Sir personally believes that students and budding homeopaths are the future of homeopathy, and it's his responsibility to add bricks for his first step of them. To cultivate the system, we have been organizing free camps to help the poor and needy peoples, workshops and seminars to promote and build homeopathy more stronger, and providing tutors to clear doubts and to guide students, publishing articles in different magazines, printing newsletters, and felicitating renowned homeopaths for their contribution in the homeopathy, as well to students and junior doctors for encouraging and build their courage towards homeopathy practice, which is the need of the time. So this is in short about the homeo healers homeopathy worldwide. So now for proceeding this program, I like to request Dr. Nidhi to hand over to you. It's over to you, ma'am.
Thank you so much, Dr. Vibha. A very warm good evening to all my dear friends, fellow practitioners, internees. Welcome to you all for National Webinar. Joining us today, two superwomen, one of our chief guests and one another is our speaker. Today's speaker is an amazing visionary. When I'm saying amazing, I mean it. Her two books entitled as Golden Book of World Record. She's advisory as Turkey Clinicals Journal, Board of Director of Afghanistan Homeopathic Medical Associate. She is scientific committee member of Hughes University, Turkey. She is an international trainer, speaker, teacher, promoter of homeopathy. She is expert in treat to autism, psychiatries, and behavioral disorder, infertility, allergic disorder, and long-lasting list. She is author of more than 8 bestseller books of homeopathy. Many international awards, distinction, gems of her crown. She is Dr. Kavita Chandak. Very happy and very welcome you, ma'am. Thank you so much to you. Now, I'm introducing our chief guest, Dr. Amita R. Manchanda, inspiration of all homeopaths. She's successful and renowned doctor in homeopathy fraternity. 34 years of rich experience in homeopathy has been providing highly quality of homeopathic care to more than thousands of families. She's developed a holistic homeopathic clinic where her clinical expertise blends with personalized care. She has expertise in holistic health, research, individuals counseling, public health, chronic illness. She is gold medalist from MPK Jaipur College, NHMC, and many more international awards, and so on. Thank you so much, Dr. Amita ma'am, coming here. Thank you so much. Over to Dr. Kavita.
Thank you, Dr. Nidhi. Before I start my session, first of all, I would love to thank you everyone for your precious time. And now I'm going to share my presentation. Okay?
Excuse me, can I disturb you?
Yeah, sure.
Dr. Amita? Dr. Amita?
Okay, I'm right here. Yes, Dr. Rohit.
Dr. Amita, आपने बताया था कि someone is in the hospital और आप उनके साथ थे, but we are really, thankful to you that in spite of that you have joined us और आपने अपना इतना ज़्यादा hectic schedule होने के बाद में भी हमारे को join किया है. So we are really, really thankful to you. I think आपने बोला था कि you will have to leave. I don't know. अगर आपका टाइम है तो बहुत अच्छी बात है. You can stay with us. So can you stay with us?
Disturbance. I can hear you now.
अभी आपने सुन लिया जो भी मैंने बोला?
A little bit.
मैंने ये बोला कि you said that you were in the hospital. Someone was in the hospital and you were there.
Yeah,
And
I was last 2 days. I'm busy, and
okay.
I have come back for
Yeah.
this. But yes, hopefully things should get better with time.
Yeah, definitely. So I think we are very thankful to you that you have joined us. We are really grateful to you. I just wanted to ask that can you stay with us?
I will be here for a while. Yes,
So
I will
nice.
be here.
So
I will be
nice.
hearing Kavita. It's always a pleasure to
Yeah, it
hear
is
her
really a pleasure.
presentation.
This is really a pleasure.
I
Please,
have
please.
heard on international forums.
Yeah.
I have been with her, shared but now I'm here to hear you as well.
So
Yes,
nice.
Kavita.
So
Thank
yeah,
you, ma'am. Thank you.
Dr. Kavita, please start.
Please continue.
Thank you. So, okay, is the screen visible?
Yes, yes.
Okay, thank you everyone. As I said, first of all, a big thank you to Nidhi Sharma and Dr. Rohit Bhandari sir. And without wasting time, let us start our session.
Yeah, sure.
Yeah. So friends, today we are going to discuss a very nice case. It is a multi-layered, complex, miasmatic case. Its name is a fight between homeopathy and stubborn, chronic, complex, multi-miasmatic psychiatric case of Cape Grass syndrome, depressive psychosis, paranoid thoughts, adjustment disorder, encephalitis, dysthymia, axis 2, and cluster with traits. See, this patient visited me with 7 diagnoses and ultimately homeopathy cured her. So enjoy the beautiful case. A 24 years girl saying that I am in 7th standard. I am just 12 years old. Fluctuation of memory. Her memory wanders in past and present. She said, people laughing at me. I hear noises of my parents fighting but disappears when I open eye. Jerking in the body. I do not recognize my brother and sister as they look different now. Their voice changed. All says you, your siblings are grown up. But this is false. It's not reality. They are liar. And I am still in 7th standard. Suddenly started weeping and she said to me that doctor, sometimes I feel happy and another time I am sad. I am all alone in this world. My family is no more now. Everybody is changed. I think I am going to be mad soon. She had lot of fears. She used to lie down in bed by shutting her eyes so that she could relax in her beautiful imaginary world. She complains that her neighbor keep on laughing at her. Personal history of frequent attacks of fever, typhoid, menorrhagia and acrid greenish copious discharge. Family history, no major illness was there. Yes, but father was alcoholic, used to be violent at home with wife and children. So you got this idea that the childhood was not that much healthy because of the unhealthy environment in the family. Now let us first discuss the journey of the disease, how it happens. In 2004, she underwent some psychiatric treatment because she had frequent headache and her family doctor referred her to the psychiatrist. In 2004 itself, her EEG done, which was absolutely normal. Then in 2005, you can see here, these are very old reports, but quite visible. In 2005, she has been diagnosed with adjustment disorder with acute dysthymia, axis 2 cluster traits plus plus. Later on, since 2009 to 2010, for the complete 1 year, she was taking some treatment from the local doctor in her village for frequent cough, cold, fever, as well dysfunctional uterine bleeding. In 2012, again her EEG performed, which was absolutely normal. But at the same time in 2012, her MRI of brain was performed, which showed the bilateral mesial temporal sclerosis with two small old infarcts in left MCA territory. Then in 2005 itself, if you can see here, this is the report of psychometry. In this psychometry report, her MQ came average, that is 112, but unfortunately, she has been diagnosed as a patient of depression in this report of psychometry. So now she has one more diagnosis in her figure. Then since 2012 July till December 2013, she was under the treatment of a psychiatrist for a long time without change of medicine, and there was no result at all. If you can see, you will observe here almost same medicines were written in every consultation, and the funny thing was that she continued the same medicine even after December 2013. She continued it till December 2014 and finally met me in January 2015. But she didn't have the prescription for December 13 to December 14. What is the reason? Because she used to call her psychiatrist who is staying miles away from her place, and the psychiatrist used to send together 2-3 months remedies together on the bus or through courier, and because of that she didn't have the prescription for the complete year 2014. Meanwhile, during this all treatment in 2013, again her EEG was performed, which was absolutely normal. In 2013 itself, MRI brain with contrast done, which showed the same report which we got in the last MRI report. In 2013, finally, see, after 9 years of commencement of treatment for psychiatric disorder, she got her diagnosis. Her neurophysician and her psychiatrist together diagnosed the case as suffering from Cape Grass syndrome plus depressive psychosis plus paranoid thoughts plus acute encephalitis illness. Poor girl got her diagnosis 9 years after, and you see, for these 9 years she was just playing doctor without any relief. So now she approached me in January 2015. So let me explain you first about the Cape Grass syndrome, because when she approached me, it was a new name, new diagnosis. I never heard about Cape Grass syndrome, but I am quite fortunate that I got the chance to treat such patient. Cape Grass syndrome, it is a disorder in which a person holds a delusion that a friend, spouse, parent or other close family member or pet has been replaced by an identical looking imposter. Patients hold the belief that time has wrapped or substituted. So this is the definition of Capgras syndrome. Her second diagnosis was depressive psychosis. Do any one of you have the idea about depressive psychosis? Did you ever get the chance to treat the patient? Please put your inputs.
I have not seen any case.
Okay. And can our participants talk or write in the chat?
And they can type in the chat, but
Okay.
mic is not allowed for them.
Okay. Vibha, can you read the chat for me?
Dr. Vibha? Dr. Vibha?
Or anybody else can read the chat for me because I cannot see it.
Ma'am, there is no chat right now.
Okay.
But yes.
There's a message.
Okay. Please read the message.
Ma'am, there are no messages yet.
Okay,
But
no problem.
I'll interrupt and let you know as soon as we receive messages on
Okay,
chat.
no problem. So let us proceed. Finally, I have to tell you the definition. Depressive psychosis is the condition causes to experience psychotic symptoms plus the sadness and hopelessness associated with depression. This means seeing, hearing, smelling, or believing things that aren't real. Depressive psychosis is especially dangerous because the delusions can cause people to become suicidal. So, we need to treat it as soon as possible. Next is paranoid thoughts. The fear of something bad happening. The idea that others may intend to cause some harm. The thought is exaggerated or unfounded. But typically, the fear is of physical, psychological, social, or financial harm. For this, since April 2005 till December 2014, she was under this treatment almost 15 tablets, 13 tablets per day she was taking. For homeopathic treatment, I considered few rubrics which I am sharing with you. I took mind, confusion of mind, time as to space and mind, cheerful, alternating with sadness. Mind, delusion, identity, someone else she is. Mind, delusion, strange, familiar things, she is strange. Mind, 4-second feeling. Mind, insane, become insane, one will. Laughed and mocked being. Delusion, noise, hearing noise. Unreal, everything seems. Then from female genitalia chapter, I considered one rubric, protracted menses, that is profuse menses, and in general, menorrhagia, anemia from menorrhagia, and jerking internally. So from these all rubrics, when I put all these rubrics in the repertory, few medicines came up, like calcarea carp, cannabis indica, cicuta virosa, lachesis, and sepia. So from the above data, I stuck with two remedies. First is cicuta virosa and cannabis indica. Can any one of you please suggest me what should I do here? See, we are discussing
Ma'am,
how to enter.
sorry to disturb you.
Yeah.
Can whatever symptoms you were telling me, can it be like alternate excitation and depression?
Yes. Yes, it can be. But we have considered the other thing, cheerful alternating with sadness, because
Yeah.
there was not excitation. And depression is a medical word, sir. We usually do not consider pathognomic symptoms
And
when we repertorize the case.
we can be considered as suspicious also.
She was not suspicious because she was facing delusions.
Okay.
Yeah,
Okay. Okay. Thank you.
thank you. So from the above data, I stuck with two remedies. First is cicuta and second is cannabis indica. Cicuta is the only remedy for mind, confusion of mind, past and present. It also covers delusion, he is a child again and acts like a child, feels like a child. But you see, presently she was not dancing or mourning like a child and no convulsions were there. So I have to rule out cicuta and I thought about cannabis indica. Let me explain few rubrics to you, few symptoms of cannabis indica to you. Cannabis thinks everything is unreal. When he speaks, it seems as though someone else is speaking. Lack of sense of identity, a connection to himself and others. There is a great fear of insanity. There is fear of approaching, fear of darkness. In short, this patient have lot of fears. Loss of conception of time, space, place, distance and size. Delusion, paranoia, hallucination are present in cannabis indica. There is confusion and difficult concentration. So ultimately, I thought I should go with cannabis indica. Few more rubrics or symptoms from cannabis indica are they get panic attacks, anxious about health and losing control. There is fear of insanity, distortion of time and space. There is disorientation. They have the habit of theorizing. All sensations, perceptions and conceptions being exaggerated to the utmost degree. Distances seems infinite and time endless. Pleasure is paradise itself, and any painful thought or feeling plunges at once into the depth of misery. The acceleration and activity sometimes giving place to sadness, depression and weakness. Shuts his eyes and is lost in delicious thoughts. You remember the girl used to she loved to sleep so that she can imagine, she can lost in her imagination world. Like they love fairy tales, they love fantasy words. There is constant fear of becoming insane. Inability to recall any thought or event on account of different thoughts crowding in his brain. Very absent-minded, like we see in the abysmal patient, they have very fixed ideas. Whatever they think, they feel that yes, this is reality. Every few minutes, he would lose himself. And we saw the same thing in the case because a 24 years girl, she was telling me, just now she told me that I am 12 years old and within 5 minutes she told me that I am 24 years old. You will see her video. Frequent involuntary shaking of the head, heavy pressure on the brain, forcing him to stoop. You see, cannabis has a typical characteristics. They feel the headache and they feel like that the top of the head, it means their scalp is opening and closing, opening and closing. There are violent shocks passed through the brain. And from the female organ, you will get very profuse menstruation. This girl has taken treatment from 2009 till 2010 from the local doctor for dysfunctional uterine bleeding. Cannabis affects nervous and sanguine temperaments most, the bilious nearly as much, the lymphatic but slightly. Dr. Handfield Jones naively describes it as physiologically a nervous stimulant and therapeutically a nervous sedative. All the time, a dual consciousness is present in cannabis. See, if the patient says himself that I have two minds, someone else is sitting in my mind and commanding me, then the remedy will be lackluster. If we observe that there are two trains of thoughts in the patient, there is confusion in everything, the patient will tell you, doctor, I cannot decide which dress should I wear. Maybe this, maybe that. Oh, what should I do? Then the patient will be anacardium. But when all the time their dual consciousness is present, like I am 24 years old I am 12 years old. So this is characteristic symptom of cannabis indica, as mentioned in the manual of pharmacodynamics by Dr. Richard Hughes. Cannabis indica, commonly known as hashish, and people love to do it for the pleasure. Cannabis indica contains 400 chemicals, in which 150 are the active ingredient, which we call as cannabinoids. The most abundant ones are CBD and THC. THC has psychoactive effect and CBD shows non-addictive therapeutic effect, and hence we use it in homeopathy as a medicine. It has a very good place in relieving pains and anxiety. Suppose any patient is consulting you for nausea and vomiting during chemotherapy. Cannabis provides amazing relief. I experienced its use in multiple sclerosis in various patients of mine. Dr. Alan Shackelford shared his experience about the role of cannabis in Rett syndrome, where the child had 300 epileptic attacks per week, and in Crohn's disease. In my practice, I use it in cases of sleep apnea, fibromyalgia, and Alzheimer's disease. Cannabis oil is used in cancer cases during chemotherapy. You see why I am explaining all other symptoms of cannabis? Because when we consider any remedy, we have to read the materia medica thoroughly, and we never read it in small portion only related to our case. Whenever we read the complete drug, we have a full knowledge of the other symptoms applicable in other disorders too. Till now, I justify cannabis indica from materia medica, how it is worthy and how the rubrics and symptoms match each other. Now, let us justify it through the repertory. See, whenever you deal any multi-layered complex miasmatic case, the first point of the strategy is justify your medicine with materia medica, with repertory, with organelle, and above all that with your observation. That is semiotic justification. So, diagnosis as per homeopathic approach, for me, it was a clear-cut case of dissociative disorder with depersonalization. Dissociative disorders are thought to primarily be caused by psychological trauma. There is loss of contact with your own personal reality accompanied by feeling of unreality and strangeness, which we had in the girl. And depersonalization is an emotional condition that involves disruptions or breakdown of memory, awareness, identity, or perception. So for me, it was a combo diagnosis, dissociative disorder along with depersonalization. And you know what? We have this rubric in our repertory, depersonalization. Honestly speaking, before this case, even I even did not know that we have this rubric in our repertory. But when you study the cases, you get more work, gradually it increases your knowledge. So I added this rubric to our already considered rubrics, and finally I got this repertory chart, and cannabis indica came on the top. Now prescription. In January 2015, I prescribed cannabis indica 7 glass method, 7 suctions, 7 drops, 7 days with placebo for 45 days. See, what I suggested her family, I told her mother to put 1 drop of remedy in a glass of 50 ml. Then stir it well. Take 1 tablespoon water from this glass and put it in other glass containing 50 ml of water. Stir well and continue the same procedure till 7th glass. This 7th glass is her remedy. She has to take 7 drops of water once in a day, maintain same time every day from this bottle. Shaking the bottle 7 times before giving medicine is mandatory. This was my instruction to her mother. What do we call this method? Yes, anyone please?
I don't see any responses.
Okay. This method is known as plussing method, and this plussing
Oh, yeah.
method is the
Sumita
biggest
said.
gift from the biggest gift of the Hahnemann in the 5th edition to homeopathy world. Did you not read the 5th edition of Organon? Please go and read it. Now
And by
follow
the
up.
way,
Yeah.
Smita Mahajan said it's plussing
Okay.
on
Thank
the
you,
chat.
Smita. March 2015. Patient felt emotional strength, memory little stable, little. Delusion reduced, fever for 8 days soon after medicine. It was a good sign for us. See, whenever we put constitutional remedy, if so many things are suppressed in the past, ultimately body is going to throw something out. Suggest the patient just to wait and watch and not to take any other medication. So, cannabis indica was repeated in the same manner again for 7 days. In May 2015, mental stability increased, leukorrhea was there, menses was regular. I gave her cannabis indica, 1 m. This time, method was same, but I increased the potency little bit because I wanted to speed up the case, first thing, and second, I observed that she reacted well to 2000 power. So it was a safe remedy for her. That's why I increased the potency. Then in August 2015, patient was much better. Cifilinum 200, 1 dose with placebo given. Now you tell me why I use Cifilinum 200 here when the case was really doing well with cannabis indica. Any answer, doctor?
It's an antisyphilitic medicine to remove the miasm.
That's it? It is partially true answer. Anything else?
Dr. Smita Mahajan mentioned miasmatic approach syphilitic miasm. Shweta
Same
mentioned
answer.
miasmatic clearance.
Same answer.
Supriya ma'am says miasmatic approach. That's
Okay.
it.
Okay, no problem. Thank you everyone for your inputs. It's partially correct answer. I would say not partially, completely correct answer. But I want to add something else. Patient was much better when she consulted me in August. Her mother asked, can I speed up the recovery as frequent visit to my city is difficult for them. They needed to change 4 buses to visit me. She was from interior forest area around 400 miles away from my place. I thought to put up a nosode to boost up the recovery. Nosode was supposed to be there somewhere in the case, but I preferred to put it now. And hence I prescribed her Cifilinum 200, yes, because of the syphilitic background. And secondly, it is a nosode. We use nosode to clear the toxins, toxic imprints from our immunity. And she had lot of toxins because she consumed lot of medicines since childhood. As well, she faced the unhealthy environment. So emotional toxins, medicinal toxins, physical toxins, everything was there. And for that, we need a nosode to clear the toxicity. And that's why I put Cifilinum 200. One more reason to give Cifilinum was when, as Dr. Kent mentioned, when a patient is slow re-establishing himself, a single dose of Cifilinum will bring him his appetite, strength, sleep and former weight. So Cifilinum really helps you to come back to your healthy status. In October 2015, no jerking, emotionally stable, fluctuation in memory is reduced significantly, placebo given. In 2015 December, irritability and headache was there, dissatisfaction, itching in genital organ. See, itching is a good sign for us because we can observe the evolution of SORA here. From syphilis, we have to shift our patient on soric miasm. So this time, because of her irritability, dissatisfaction, I finally repeated cannabis indica 1M in the same manner. In February 2016, she felt energetic, optimistic, memory stable. There was slight coryza with fever. I did not interfere with her vitality. I felt that I should wait and watch. This is the time to keep quiet, and I just gave her placebo. Then in April 2016, her progress was fantastic. Confidence improved, can travel alone. Anxiety about exam caused headache with burning in the body. So I again prescribed her cannabis indica 1 dose. In June 2016, I gave her tuberculinum 200 as an intercurrent remedy. But I just want to ask you, when I already put syphilinum to her, then now why tuberculinum? On which basis I chose two anti-miasmatic remedy in this case. One I already explained you. Now you explain me about tuberculinum.
Dr. Shweta is saying to follow well.
Okay. Anything else?
No, ma'am, that's it.
Okay, no problem. Why tuberculinum? Cannabis covers all three major miasm, but in this case, syphilis was the dominant miasm. I already gave her syphilinum. Now I wanted to push soric evolution because genital itch has already told us that sora is evolving, and I just wanted to push that soric evolution. But at the same time, I want to cover the current dominant miasm. Understood? So we needed a remedy which should cover both things, the syphilitic miasm as well as soric miasm, and that's why I chose the tuberculinum. Now let us see the videos before and after treatment. Before that, I would love to tell you her December follow-up, much better, memory stable, confidence improved, and I just gave her placebo. Now see the both videos.
मुझे अपने भैया और अपनी सिस्टर के फेस नहीं आती ये ऐसे नहीं दिखता भैया है अच्छा तो फिर कैसे दिखते थे भैया पहले गोरे गोरे छोटे थे अच्छा दीपाली अभी तुम कौन सी कक्षा में हो सेवेंथ में हो कौन कौन से सब्जेक्ट है तुम्हारे अच्छा और 6 का क्या परसेंटेज था मेरा परसेंट था 86 वो पूरा घूम रहा था कभी अंधेरा आता है बहुत ज्यादा कभी आवाजें बहुत दर्द देती हैं यहाँ बहुत दर्द होता है इस साइड में यहाँ कभी दर्द होता है कभी इधर आ जाता है दर्द काले रंगों से हमें तो डर लगता है अच्छा और नागपुर आने से डर लगता है क्यों यहाँ गुम हो जाते हैं पकड़ के रखा था ना पापा मम्मी ने और क्या क्या डर लगता है जाए जल्दी तो मेरी मम्मी पापा ऐसा लगता है मेरी मम्मी पापा भाई बहन सब मर गए हैं मैं अकेली जिंदा हूँ अच्छा और क्या कर रही हो तुम अकेले जिंदा रह के मम्मी क्या कर रही है, ऐसा लगता है। फिर लगता है मैं बहुत फिर रोती हूँ, फिर ठीक भी हो जाती हूँ। अच्छा नहीं लगता और कभी कभी खूब अच्छा लगता है। कभी पहचान भी आते हैं और आवाजें बदल गई हैं सबकी।
आवाजें बदल गई हैं। अच्छा, तुम्हारे भी तो
बड़ी मम्मी की आवाज पहचानी से लगती है मेरी मम्मी से। बाकी मेरी छोटी बहन जो है ना, वो बिल्कुल भी याद नहीं है। भैया दिखते हैं क्योंकि ये मेरे साथ हमेशा थे।
भैया कौन सी क्लास में अभी?
भैया बोल रहे हैं कि मेरा इंजीनियरिंग हो गया। फिर बोलते हैं कि नहीं मैं मैनेजर बन गया हूँ।
अच्छा, तेरे अभी भैया क्या कर रहे तुमको पता नहीं है? नहीं पता है। और बहन क्या कर रही है अभी?
सब बोल रहे हैं कि हम बड़े हो गए हैं, तुम भी बड़े हो गए।
अच्छा,
मैं नहीं मानती।
तुम नहीं मानते? तुम कितने साल की हो? 12 साल की।
मैं जब सोने जाती हूँ तो बहुत सारी शोर होता है। चिल्लाते हैं
पापा जी चिल्लाते हैं? क्या बोलते हैं? अच्छा, कौन कौन झगड़ते रहता है? मम्मी पापा दोनों लड़ते हैं।
भैया और मैं पढ़ते रहते हैं
और मम्मी पापा लड़ते हैं।
ठीक हो जाते हैं। जब मैं खोलती हूँ आके तो कुछ नहीं दिखता। हंसते हैं। वो हमारे बाजू वाली आंटी है ना, वो हमेशा मुझे हंसते रहती हैं।
आज की डेट क्या है दीपाली? मैं भूल गई डेट आज की क्या है?
आज है 19 तारीख।
कौन सा महीना?
19 तारीख है और सितंबर है।
अच्छा, और साल?
साल है 1999।
1999।
बहुत ज्यादा डर लगता है।
क्या डर लगता है?
कोई मुझे समझना नहीं
उसी के लिए तो अपन ये शुरू किए ना, धीरे धीरे उसको बंद करेंगे।
करो तो समझ आता है, फिर समझ नहीं आता। और मैथ्स पढ़ो तो बड़ी मैथ्स नहीं समझ आती और इंग्लिश भी ढंग से समझ नहीं आती। मेरी 6 की बुक्स सब छुपा दी है।
So friends, this was the case, and did you observe the tone, the voice? A 24 years girl is talking like a child, and during this video she pointed towards her mother and she said, my aunt is looking like my mother. She is her mother only. She did not, there was no other person in the home except mother, daughter and her brother and father. Now see the follow-up or video after homeopathic treatment, after 21 months after homeopathic treatment.
पीएससी उतना अच्छा नहीं गया क्योंकि बहुत टफ होता है, मतलब सेकंड में वो अच्छा तो निकल जाएगा। किसी का भी नहीं निकलेगा, जिन लोगों के निकल रहे थे उनके भी नहीं निकले।
Sorry.
अच्छा के एग्जाम पीएससी उतना अच्छा नहीं गया क्योंकि बहुत टफ होता है, उतना अटेम्प्ट किया, मतलब सेकंड में वो अच्छा तो निकल जाएगा। किसी का भी नहीं निकलेगा, जिन लोगों के निकल रहे थे उनके भी नहीं निकलेंगे। अच्छा अच्छा लगा एग्जाम देखी, कैसा लगा? अच्छा लगा कि चला मैंने कॉम्पीट किया। लेकिन काफी टफ था, वो अलग उसका था, बैंकिंग सेक्टर और मैनेजमेंट से मैटर से रिलेटेड था। तो कुछ और ही पूछा तो सभी के साथ ही सिचुएशन थी, तो मुझे लगा कि नहीं कॉमन है सबके साथ। बैक पेन वो पूरा सब बंद हो गया। मेरा वो वाइट डिस्चार्ज वाला प्रॉब्लम भी ठीक हुआ, पर जैसे अब हमेशा ये होता था कि इनको शाम को सुबह चिड़चिड़ा पर वो नहीं होता। मैसेज भी सही आ रहा है। अभी जैसे पिछले मंथ मेरी 20 तारीख थी, इस मंथ शायद अभी ही रहेगी 14-15 सुबह। पहले से मैं बहुत ठीक हूँ और बहुत हैप्पी फील करती हूँ। मैं आपको बहुत थैंक्स बोलने आई। मतलब पहले से मैं बहुत जल्दी अपने मूड को डाइवर्ट कर लेती हूँ। जो मेरा डाउन रहता है, कभी सोचती हूँ, बहुत जल्दी इमोशन सेंटिमेंट जो रहते थे वो मैं खुद में कर लेती हूँ, तो मेरे आंखों से हाथ से जल्दी नहीं निकलती। तब गुस्सा भी नहीं, ज्यादा हाइपर भी नहीं। जैसे मम्मी बात करें, हाँ मम्मी होता है, मैं ये नहीं करती थी। अच्छा, अब मम्मी से अच्छी बॉन्डिंग हो गई है। और पापा से भी करते हैं, वो बोलते हैं कि हाँ बेटा 1 साल 2 साल कर लो फिर नेक्स्ट ईयर वो बोल रहे हैं सभी शादी करना है ऐसा, मतलब अब डर भी नहीं है कि शादी करना है, तो वो बहुत जल्दी अंदर ही अंदर घबराहट होने लगती थी कि क्या होगा कैसे होगा, वो चीजें हट गई। पॉली इमेजिनेशन वाली जो मेरी है नींद में जाकर के मैं बहुत एज्यूम करती हूँ, तो मैं तो वो इमेजिनरी लाइफ अच्छी लगती है, मेडिटेशन वाली वो ज्यादातर 1 महीना रहा मेरे साथ, मैं वैसे ही करती सोती रहती थी ताकि इमेजिनेशन में जी सकूँ और फिर खुश रह सकूँ, फिर ऐसा तो। लेकिन अभी काफी ठीक हुआ। हम कब मिले थे बेटा पहली बार? 5 जनवरी 2015 को मिले थे, ठीक है। उसके हिसाब से आज की तारीख में तुम कितना परसेंटेज मुझे लग रहा है कि मैं 100 भी हूँ, लेकिन 75 ठीक हूँ। 25 थोड़ी सी नेगेटिविटी है थोड़ा सा, लेकिन जो डर है मेरे अंदर से बहुत कुछ निकल हर चीज का अभी डर नहीं। मुझे लगता है कि अब मैं मैच्योर टाइप हो गई हूँ, अब बड़ी हो गई। कंप्लेन पे कंप्लेन करते आती थी कि मेरे पापा से उससे वो है ये लगता है कि नहीं, वो समझने का अंतर था। फिर दोनों साइड जब देखना शुरू किया कि इसका पॉजिटिव भी इसका नेगेटिव भी, तो मुझे हर चीज सही लगने लगी। अभी कुछ आवाजें सुनाई दे रही बेटा जैसे पहले देती थी? कुछ नहीं। इतना हैप्पी इतना पॉजिटिव लगता है कि मैं सब कुछ कर लूंगी, मैंने अभी कुछ भी नहीं खोया है, आज से लाइफ स्टार्ट की, अभी कुछ भी गड़बड़ नहीं हुआ है। अभी से मतलब हर चीज की परफेक्ट टाइम आया है। मुझे लगता था कि इससे परफेक्ट टाइम कोई हो ही नहीं सकता। बहुत सारा थैंक्स मुझे मतलब इतनी अच्छी लाइफ दी आपने, मैं बहुत खुश हूँ। मुझे डर नहीं है, मतलब खोने का जो डर बना रहता था हमेशा उसकी वजह से भी, और सबको मम्मी पापा को छोड़ने का डर, ऐसा लगता था कि मैं डिपेंडेबल हो गई हूँ। ये सब बहुत सारे अंदर मन में बहुत ख्याल रहते थे जिसमें आपसे बोल भी नहीं पाती काफी टाइम। अब अच्छा लगता है कि नहीं, मैं तो अकेले भी कहीं सोची तो मैं रह लूंगी, मैं तो बूढ़े होते तक आपके पास आना बिल्कुल नहीं।
So, friends, see, the complete personality has been transformed with homeopathy, and this is the victory of our homeopathy. And for that, I would like to thank Organon. You see, I have various points, and this is the time to justify our remedy with Organon. But as we have to respect the given timeline, I am just sharing the aphorism numbers with you, the aphorisms which really help me in selecting potency and remedy in this case. So, aphorism 246, 247, 248, 251 and 258. Never be prejudiced to any remedy is also important. How to repeat the dose, how to increase the power of medicine, repetition of medicine in the same potency, and mode of employing medicines in chronic diseases. If you will read all these aphorisms, you will definitely get the knowledge how to repeat the potency and when to increase the potency. Now, semiotic justification. I first told you in the beginning that we have to justify our remedy from all the dimensions, because if you want to cure the multi-layered complex miasmatic cases, your remedy must be a strong weapon for you, and it can be only strong if it is justified through matremedica, organon, repertory, and with your observation. That is semiotic justification. As I blurred the patient's face, you were not able to see her face, but her face was typical cannabis indica face, varied, exhausted appearance, drowsy, stupid look, and mouth, lips filled as if glued together. Dark lips and stickiness was there on her lip. Now, strategy to deal such patient. First of all, consider the nature of the patient, whether your patient is hypersensitive or hyposensitive. Second, consider the nature of the remedy, whether your remedy, selected remedy is deep acting or short acting, and nature of disease, whether it is acute or chronic. We had chronic disease with in a hypersensitive girl. So that's why I use plussing method. See, all these 3 points, nature of the patient, nature of the remedy, and nature of disease, will tell you how to repeat your potency, and it will make you safe from getting medicinal or homeopathic aggravation. The 4 key filter to proceed in such deep miasmatic cases is, first of all, consider the susceptibility of the patient. In this case, it was high. Second is precipitating factor. Emotional stress was there, psychological trauma because she got very unhealthy childhood. Father was alcoholic. You can understand he used to beat her mother in front of her. Then process of disease, losing harmony, how the patient lost his harmony. In this case, she losing contact with reality was her status. That is annihilation of Sora. Somewhere Sora got hidden. And fourth point, you need to consider key filter to proceed in such cases. What could be the result or what my medicine is giving to me? In this case, the result after all this situation in the patient was she isolated herself, fear of insanity was there, disassociation and depersonalization. The homeopathic treatment broke her delusion and helped in accepting reality. Homeopathy transformed her life. Fluctuation in memory is very well controlled, almost finished. Patient is independent and very, very happy when appointed as labor inspector. She received government job of sanitary inspector in her area. And now she is doing job and right now she is preparing for RJ. Her ambition is to become RJ, radio jockey. The well-selected homeopathic remedy and the associated reduction of conventional medication finally could solve the multi-diagnosed complex case and create the victory. As soon as I increased my dose, I gradually tapered the conventional medicines and she got rid from all those conventional medication. And finally, I stopped homeopathic treatment even after 21 months of the medication. A case with 7 diagnoses finally cured with 1 unique homeopathy. Now, see, you are not done here. Suppose we solve a case, we are not done there. We must know what are the criteria for selection of remedy in such deep cases. Human being is made up of all 5 elements. Panchatattva. You know, we call that we are made up of the Panchatantra. And we have characteristics of all kingdoms and miasms inside us. Let me give you one example to explain it thoroughly. A girl typically pulsatilla in childhood. When grow up and complaining examination funk with anxiety and nervous diarrhea, we may think about argentum nitricum, which is not plant. Pulsatilla was plant, argentum nitricum is mineral. In future, suppose she land in kidney disorder with anasarca. What will be our first remedy? Obviously, apismel. Animal kingdom. You see, kingdom and miasm, all kingdoms and all miasms present in every human being all the time. But we consider the dominant miasm and dominant kingdom for selection of remedy. Kingdom and miasm changes according to the present scenario in one individual person. Hence, we cannot tag anybody belonging to particular remedy or kingdom like we tag people on Facebook. Be flexible and just go with what you are watching at the moment. This is the best strategy to prescribe your remedy in such complicated cases. First of all, keep your mind open and think out of the box. Don't apply any category immediately. Like when we start case taking, we feel that, oh, I feel she's from plant kingdom. No, she is from animal kingdom. No, please don't apply any category immediately. Select the remedy justifying the current dominant kingdom and miasm. Every case is unique as mentioned by Hahnemann in aphorism 83. Try to find out what is uncommon in that particular case and pay importance to individual fact. See and feel the patient. Observe and accept the patient as he is. Avoid extrapolation. No imagination or extrapolation of the homeopath is allowed. Just pure observation. And please follow aphorism 5. It is not only for reading or not only just to pass the dialogues, but it is for implement in the practice. Don't be biased because every patient is new and every case is new as mentioned in aphorism 83. Only unbiased minds can pursue. You see, apple fall, Everybody saw, but only Newton perceived. And that's why he became genius for the world. This case of mine was, I presented this case in World Congress 2017 at Germany. 8 million people die each year due to mental illness. 90% of suicides are related to depression, mood disorder, schizophrenia, anxiety disorder, personality disorder, eating disorder, sleep disorder, substance abuse, mental retardation, dementia, paranoia, mania, and so on. It's a long list, you see. In homeopathy, we already have valuable rubrics for all about disorder. And in that way, we can solve such cases and we can stop, we can help the people, we can prevent the people dying from mental illness. We can't reach for anything new if our hands are still full of yesterday's junk. Why I wrote this take-home message? Because various doctors I found during my seminars and webinars and all teaching in my colleges like that, I found various doctors says that if the patient is pulsatilla since the beginning, till the day of death, the patient will remain pulsatilla. No. To change is the universal law. As everything changes, miasm changes, dominant kingdom changes. So don't prejudice and don't go with the fixed ideas. Just clear your hands from the yesterday's junk and accept the new knowledge. Because era has changed, lifestyle has changed. So this is all for today's session. Thank you everyone for your patience listening, and thank you Dr. Nidhi and Dr. Rohit sir for providing me this platform. Thank you Amita ma'am for being there, and thank you Vikas sir for your technical support. Thank you Vibha. Thank you audiences. Any question?
Thanks to you.
Thank you so much, ma'am. Thank you so much for this great presentation and the guidance to handle the difficult cases like this. What you explained here today, it was really wonderful. I request all the audience, if you have any question, you can put on the chat box. Till that, ma'am, it was very knowledgeable session. It was very impactful session to learn the clinical things and learn the real application of organon in practical cases here. And it was wonderful, like always, to listen you today also. So thank you so much for being with us today also. And we are just I always told you this thing, that I'm expecting more and more session and more learning from you. So thank you so much for being with us.
This was really wonderful. I mean, the selection of the remedy, and as well as when you use that anti-miasmatic and so to boost the treatment, and then you used so which is two anti-miasmatic miasms are there, tuberculinum. So that was really wonderful. We have learned something very new, that we must go ahead with the case with something additional what we have learned today. Thank you so much for that.
Thank you so much, sir.
Thank you.
Nidhi
Great.
can't hear you.
Dr.
Thank
Nidhi,
you so much. Thank you so much, Kavita ma'am. So insightful miasmatic treatment and selection of medicine. Today we learn. And looking forward, ma'am, to so many other webinars in future, expecting your guidance also in future. Thank you so much, Vikas sir, and our Nux consulting team for technical support. Thank you so much, Rohit sir, for your guidance.
Thanks
Thank
to
you
you.
so much.
Thanks to you. We all are very thankful to Dr. Kavita ma'am. First of all, Dr. Amita Manchanda, she has to leave. She just now sent me a message that because she was in the hospital, some of her very close relative was in the hospital. She joined us from there only. So we are very grateful to her, and a very wonderful and knowledgeable session. And
Lots of feedbacks also, ma'am. Lots of listeners are giving lots of feedbacks. The wonderful presentation. Thank you so much. Wonderful session, ma'am. Thank you so much. Amazing session. Very nice explanation. Thank you, ma'am. Lots of many more listing, ma'am.
Okay. Thank you, everyone. Hope to see you all again.
we are looking after for another sessions with you.
Thank you so much. Definitely, we will do that.
Thank you. Actually, so many of my students, I'm in a college, and so many of students are, confused about the selection of the miasms.
Right.
They just want to, differentiate or what exactly is the miasm of the patient.
Mhm.
So can we have a, webinar on this topic?
Yes, definitely. Definitely. I have a 3 days seminar presentation ready about miasm.
Oh,
3 days seminar
that's
school.
that's
But
great.
for webinar, we can take any one topic from that seminar and we can do it. No problem.
So nice of you. Thank you so much.
Thank you. Yeah.
So
Thank you
thank
so much, ma'am. And sir, I think with the permission of ma'am and you, I think we need to conclude our today's session here.
yes, definitely.
Yeah. So thank you so
Thanks to
much,
everyone.
everyone, for
Yeah,
yeah.
thanks to Dr. Kavita, thanks to Dr. Nidhi, thanks to Dr. Vibha also, thanks to Mr. Vikas and his team, thanks to Dr. Amita Manchanda, thanks to all the participants. We are really thankful to all of you. Thank you so much.
Thank you. Good night.
Thank you, ma'am.
Good night.